AM 1430 KRGI, 105.5 FM. Good morning, I'm Brian Gallagher. We have a guest in studio today from Central District Health Department. Colette Evans has come by to visit with us about cervical cancer and its prevention. First, welcome. It's good to have you here.
Thank you. It's good to be here.
So, National Cancer Prevention Month. There's a lot of different types of cancers, but cervical cancer is one that we're going to focus on today. Let's explain why.
Well, cervical cancer is the fourth most common cancer in women worldwide, and it's the leading cause of cancer-related deaths among women. One of the things that we focus on is that the common virus HPV causes most cervical cancers in women and men.
A virus that causes cancer. I remember when that discussion first came out, and they have aggressively tried to get on top of that. But as we have seen with other viruses, sometimes they just don't want to know when they should go away.
That's correct. That's correct. The HPV virus can stay in somebody for years before it rears its ugly head and says, I'm here. If with early detection, it's treatable, and we have the HPV vaccine now, which prevents the cancer.
That HPV vaccine, is there an age limit as to when it can be administered to try to prevent the recurrence of that or the appearance of that? Absolutely.
So the recommendation is that children between the ages of 11 and 12 can get their vaccine. It's a 2-shot series. Unless they're over a certain age, then it's a 3-shot series. And they can receive it up to the age of 26. And if a person is over the age of 26, and I want to say up to about 40 years of age, that becomes a clinical decision that somebody would need to talk with their doctor about.
All right, I'm just going to ask, is this men and women?
It is men and women.
Okay, so for a guy like me who's well beyond those age categories, what should a guy like me do? Just write it out, or what's real?
You would want to talk with your physician and see if you would be a candidate for the HPV vaccine. Otherwise, you want to do preventive screenings, make sure you're going in and getting your annual exams with your physician and following those recommendations.
Well, those exams have become part of my life again, so I'll make sure I bring up HPV and see what Doc says, and we go, huh?
There you go.
I can't wait. All right, we talked about viruses and the problems that we've been dealing with now for a couple of years in regards to the COVID and all of the different variants. You still have NOMI down at the Central District Health Department out in the parking lot, and it seems like that rush that was happening in January has subsided.
It has slowed down some, and because of that, NOMI has opened their testing up without the need of an appointment. We had gone for a short while where you needed to have an appointment to get the test, and you no longer need the appointment. They just ask that you register on their site.
And get vaccinated.
All
right. If folks have questions or they just plain need more information about HPV or anything else, what should they do?
They should call us at the health department at 308-385-5175. I do want to say that we do give the HPV vaccine at our office without regard to status of insurance.
All right. Colette Evans from Central District Health Department. Thanks, and stay safe, okay?
Thank you.
Good morning from AM 1430 KRGI, 105.5 FM.